I know some of you will wonder that, how can I know that I am infected by toxoplasmosis? Well, there are many signs or symptoms which are not specific. That is why diagnosis has been carried out to measure what is the disease. Now I'm going to explain what is the diagnosis that can be done to confirm toxoplasmosis. The first diagnosis can be done is the serology testing. By using immunofluorescence assay IFA and enzyme-linked immunosorbent assay ELISA can detect IgM and IgG to determine the infection with toxoplasma. These two methods are the most used technique and performed by many laboratories nowadays. The second diagnosis is molecular diagnostic, such as the PCR polymerase chain reaction can detect parasite genetic material in detecting abnormality of baby. The next one is direct observation by using microscope to observe the stem tissue section of the parasite. Biopsy material can also be taken from the brain to observe. There are additional diagnostic tests can be done for pregnant women such as amniocentesis or ultrasound to check the baby whether has congenital anomalies. The next video will explain to you what is the treatment that we use to treat the toxoplasmosis. Treatment can be differentiated into healthy people with symptoms, people with HIV or AIDS, pregnant woman and baby. For healthy people have symptoms with acute toxoplasmosis, a combination of drugs such as pyrimethamine, sulfadiazine, and folic acid is introduced. On the other hand, people with HIV or AIDS can be treated with same combination of drugs or alternative drugs such as pyrimethamine and clindamycin. For pregnant women and baby, if a woman was infected with toxoplasmosis before 16 weeks, there is no treatment will be given. If a woman was infected with toxoplasmosis after 16 weeks, a combination of drugs will be given. After baby was born and infected with toxoplasmosis, a combination of drugs will be given by doctor. Remember that prevention is always better than cure. That is why we always remind the public to keep themselves more hygiene and stay healthy. The next video will teach you how can you prevent yourself from the toxoplasmosis. 5 main prevention and control of toxoplasmosis. Firstly, you must make sure the food is fully cooked and the temperature to cook the food is 75 Celsius above. Next, you must make sure your cats are vaccinated at least once a year against toxoplasmosis. On the other hand, make sure your cats always eat clean food. In addition, you must wash your hands frequently after touching your cats. Lastly, for women who wish to conceive, should seek doctor advice on prevention of toxoplasmosis transmission to baby.